Hey everybody, it's Dr. Mike Goetsch, and I want to start this series for my patients. This is something that a lot of people ask me why this happened throughout their care plan or why this treatment didn't work. And I found a pattern here in medicine about why medicine or why this doctor failed at being able to treat my diagnosis. I want to highlight many different treatments, many different diagnoses that many of you guys have been diagnosed with. And you were given a pretty solid treatment plan and it didn't work. And I want to cover all those variables that could influence why you didn't get the outcome you were looking for. You know, in medicine and in research, they always say, this was 60% effective for treating X condition. Well, if it worked for some people and you tried to keep the same treatment protocols, why didn't it work for others that had the exact same diagnosis? What are those little variables that can't be controlled, or can they be controlled in real life? And that's what I want to highlight. I've had so many patients that when I get them to me, I'm like, this is going to be a slam dunk. I know exactly what's wrong with them. I know exactly what the research says, and I'm going to do this treatment to the best of my ability. But then they didn't get better. And I got really discouraged. And I was like, did I do something wrong? Was the research wrong? Did the patient do something? What happened? And I was so confused. But I've kind of been mulling this thought over, and I believe we've been looking at healthcare and medicine and treatments all wrong. Some of the brightest minds in medicine could be treating things completely wrong. Not because they're doing it incorrectly according to the research, but because we're focusing on the wrong thing. We're focusing on X condition, whatever that may be, and we're like, the research says for this condition, I have to do this. And you have a 60% chance of getting better. Well, I'm really interested as to how we can get that to 100%. We need to look at the variables that could be influencing these diagnoses, not so much the diagnosis itself. Once we've figured out the diagnosis, it's actually very easy in medicine to treat. It's this long, this protocol, and you're going to get better. However, there's always that time that it doesn't work. Okay? And that's what this series is going to be on. I don't know where this is going to lead. I have a few things that I'm going to talk over in my specialty, chiropractic medicine. But this is further reaching than just physical medicine. This goes into traditional medicine, hospital care, urgent cares, those types of things that I want to highlight so that you, the patient, can be empowered to control those variables outside of the hospital. It's almost crazy to think that 3% of your day at the doctor's office will make 100% a difference when 97% of the rest of your day you're going and doing things that could be contrary to what is best for your outcomes. And that's what I want to highlight. I want to highlight the other 97% of your day that could be influencing your care, so that when you do go to the doctor and he gives you that medication or he gives you that treatment plan, it's going to be the most effective that it can be. I want you to be empowered so that you can take care of yourself long term, so we can reduce the amount of healthcare costs that are in America today. People are so sick and medicine is so expensive, and we're creating this existential crisis that, if not figured out, we're going to be in some serious trouble long term as Americans and in the world. Now, I want to make my small contribution to the entire healthcare industry and try to help patients control that other 97% of their day so that us doctors can get you the best results that you want. I look forward to many of these discussions between each and every one of you out there. Even if it starts small with 2 people and I can help 2 people, I believe that this will be a benefit. I hope you guys have a great day. I look forward to posting the first video very, very soon.